What does tesofensine do? First of all, I appreciate that question because tesofensine is, I look at it as like my focus day co-pilot. I mean, tesofensine, it's a dopamine modulator, serotonin modulator, and you get a little bit of epinephrine, so it's like you're creative and you're in flow state. But there's some downside that we'll talk about. So in this video, we'll talk about what is tesofensine. People think of it for weight loss. In the clinical context, people lost around 10% of their weight in about 6 months with the daily pill, but the side effects is also something that was noteworthy, including increased heart rate, in some cases trouble sleeping. So today we'll break down how it works, what the data shows, where things stand right now. And so we'll unpack tesofensine, what it does in the brain, and what the human data shows, where there's the risk-reward conversation, where it stands, no hype, just mechanisms, numbers, context. I'm Regan Archibald, founder of Ageless Future, and I believe that health is your most important asset. And when it comes to health, it's not just tesofensine to change your body composition, but it's also looking at your brain, looking at your quality of life, your creativity, your ability to do the things that you want to do in your life without risking future health. And so tesofensine, if used improperly or without the right medical oversight, you may be doing more harm than good, because this is a triple monoamine trigger, and what that does is tesofensine blocks the reuptake of dopamine, serotonin, and norepinephrine, and technically it also inhibits DAT, NET, and SERT, and that keeps these neurotransmitters active longer in the synapses and amplifies signaling in appetite and reward circuits. And so because dopamine pathways help assign value to food or anything that we find meaningful, when you change the dopamine pathways, you change the way that your body craves certain things. So your hunger is reduced, your satiety is experienced at a sooner level. Not to the results of like a GLP-1, but it can be a great appetite modulation if you're cycling off GLP-1s or for some reason you're in that small subgroup of non-responders. It doesn't give your body a dramatic metabolic boost, but the fact that there's norepinephrine in it, what some of the studies show is that you do get a nice increase in thermogenesis. So here's one of the studies in diet-induced obese rats. They gave them 2 milligrams per kilogram for 16 days with reduced food intake, and they saw a body weight reduction without clear short-term tolerance issues. Researchers also observed changes in dopamine transporter binding, confirming central nervous system engagement. In controlled human metabolic trials, they looked at these studies with tesofensine increased satiety, reduced hunger. It also increased total energy expenditure, and that shifted your body into fat oxidation, which is what you want. In another study, this was published in nature.com, they found that there's a weight loss data, there's a drop in a 24-week phase 2 randomized placebo-controlled trial with 203 individuals with obesity, and they evaluated daily oral doses of 0.25 milligrams, 0.5 milligrams, 1.0 milligrams, along with caloric restriction, and that was published in The Lancet in 2008. And in the mean weight reductions that were dose-dependent, people lost 4.5% at 0.25 milligrams, they lost 9.2% at 0.5 milligrams, and 10.6% at 1 milligram, and then 2.2%, 2.0 with placebo. So participants also reported higher satiety scores, and those results occurred in structural trial settings with dietary support. This was originally, if you think of tesofensine, originally it was looked at for neurological conditions like Parkinson's disease. And what they found is in Parkinson's, the unintended side effect was that people were losing weight. They lost 4% over 14 weeks in these trials involving 968 participants. In this more recent phase 3 program in Mexico, 372 participants reported about a 10% weight reduction at 24 weeks. with regulatory submission that was reported. Tesofensine right now is not currently approved in the US for any particular condition, but they've looked at it for a variety of things. You know, when it comes to Parkinson's, just that dopamine reduction and just kind of that flat affect, that lack of motivation, just the lack of meaning in life that dopamine and serotonin bring. They were using tesofensine to see if it turned the brains on, to see if it allowed Parkinson's patients to feel better. Now we're seeing, you know, even though it's not currently approved in the US or the EU for obesity, there's studies that show these endpoints in phase 3 obesity registration trials. You know, we're seeing more and more things come up on tesofensine. Some of the risk versus reward reality, because tesofensine, it's modulating, it's that dopamine, serotonin, norepinephrine reuptake. They're looking at, you know, what are the cardiovascular and psychiatric risks? You know, we got to have a safety discussion on this, because monoamine reuptake inhibitors, that does require changes in heart rate monitoring, looking at mood shifts, anxiety-related effects. And unlike the GLP-1 receptor agonists, we just don't have the same large long-term cardiovascular outcomes. I think in the future we will. That, you know, a lot of these outcomes, they do define the current evidence base. So tesofensine, it's oral, which is great. You can use it daily, every other day. It's got a little longer half-life. It offers the convenience compared to a lot of the injectables. But, you know, once again, there's decisions that hinge on, you know, sustained efficacy and long-term safety data. You know, it's not just out of convenience alone. So where are we when it comes to tesofensine? Well, it's centrally acting as a triple monoamine reuptake inhibitor that reduces food intake by altering neurotransmitter signaling that's tied to appetite and reward. Trials do show meaningful average weight reduction over 24 weeks in structured settings, but once again, we still are measuring the cardiovascular metrics, psychiatric considerations. Some people do notice that with the tesofensine, that sleep is disrupted. And so this is one reason why, if it's something that you and your doctor decide may be the most appropriate treatment for you, maybe you're cycling off a GLP-1, maybe you're looking to get locked in when it comes to creative projects, maybe you're looking for relief from like low-grade anxiety or depression, maybe it's ADHD. I think there's a lot of benefits that we're still learning about when it comes to tesofensine. There's unknown things, but hopefully as the research evolves, we'll see a dramatic uptake in our knowledge around what tesofensine can or cannot do. And so I'd love to hear what your experience has been on with tesofensine, if you've been able to work with a provider in getting it. I'd love to hear what your results have been. Please put it in the comments below. For those of you who are looking to go deeper and expand your knowledge, not only pay down that ignorance debt that we all have when it comes to our diagnostics, but get your blood labs ran, look at your gut, look at your brain function. All you need to do is go to agelessfuture.com, meet with one of our health specialists there, and what they'll do is they'll help you find the right roadmap so that you can decode what's going on in your body and have the most strategic approach that I know of in longevity medicine. So I'm Regan Archibald, appreciate being on the channel. I'll see you on the next video.